Postoperative expectations for wisdom teeth are situational dependent. If the teeth are super impacted, if they're way down in the jawbone, if they're completely covered by bone, it's gonna be a little sore for a few days. Sometimes, and this is why we really prefer to kind of coordinate with the patient's dentist, we like to get to the patient at the right time. And so the right time has to do with the developmental stage of the teeth. So we look at where the root development is. And when those roots are about 1/2 to 2/3, maybe 1/2 to 3/4 developed, that's a prime time to get those teeth out. The teeth will come out more easily, which I don't mind taking out difficult teeth, but when the teeth come out more easily, the patient's recovery is a lot better. And so if we can get to those patients at the right time, the recovery is pretty minimal usually. Now, postoperatively, day 3 is when the inflammatory process is really gonna peak, and that is when they're most uncomfortable. So 48 to 72 hours after the surgery is where they're gonna be the most uncomfortable. We really hammer anti-inflammatories for the first few days, lots of ice, try to keep that inflammation down as much as possible. After patients have hit that inflammatory peak, then we let them start transitioning their diet back towards a normal diet. For the first few days, milkshakes, smoothies, ice cream, mashed potatoes, all that stuff that we really enjoy eating, but we probably shouldn't. That's the diet for the first few days. I tend to joke with patients, it's kind of like a Netflix milkshake and chill for the first few days. Once we're past that phase, you're really waiting about a week before you feel back to normal. I typically tell patients no heavy lifting for the first week. So people can go back to school or back to work after they've gotten over that inflammatory peak, but it's really about a week or so before you're feeling back to normal and can resume sports or heavy work duties. One of the most common questions we get is, why am I gonna have this delayed pain? I do really well for the first few days, and then about day 4 or 5, all of a sudden my jaw starts throbbing. And so those patients come back into our office, and a lot of times they're thinking, hey, I've got a dry socket. We take one look inside of their mouth, and it's very obvious that the holes that were created from us removing their teeth are packed full of food. And so when you have so much food that's packed into these holes, it creates, again, a lot more inflammation. And so for the first few days, the anti-inflammatories will help out, it goes well, but as the amount of food in those sockets accumulates, it really becomes uncomfortable. So at that point, all we have to do is just go in there, we irrigate out those holes, the food comes out, the patients feel immediately better. And so this is why in the postoperative instructions, we go over, hey, we're putting this irrigation syringe in your bag. We want you to start using it at a certain time to try to cut down on this food that's in the sockets. And that's one of the more common questions we get, but it's easily treatable and hopefully it's easily preventable.